Merci, Monsieur le Président.
Thank you, Mr. Chair and members of this committee. It is a great honor for me to be here today with you to speak as witness to my bill, C-442, an act respecting a federal framework on Lyme disease. This bill was designed in a nonpartisan spirit to help people across this country. I hope that in a similar nonpartisan fashion, we may set up the federal framework included in this bill. This bill would create a collaborative framework between federal, provincial, and territorial ministers, and would also include representatives from the medical community, scientific researchers, and other groups in order to combat the problem of quickly diagnosing and treating this disease.
From the hearings that we had on the House side, that there is a strong scientific consensus. We had evidence from Health Canada, from the Public Health Agency of Canada, confirming what I had suspected, but I must say I thought I knew quite a bit about Lyme disease before the hearings in the House. And I was quite taken aback by the evidence from the Public Health Agency of Canada. The evidence that you'll find from the House committees, and no doubt you'll hear more here before the Senate, but the Acting Director General of the Center for Foodborne, Environmental, and Zoonotic Infectious Disease Prevention and Control Branch, I'm sure there's an acronym for that, but I can't think of what it would be, at the Public Health Agency of Canada, testified that within the Public Health Agency, they are now anticipating that for Canada, we can expect over 10,000 Canadians to develop Lyme disease every year, starting in by the 2020s, as they testified. It is a rapidly spreading infectious disease, and as was stated in the support for C-442 from the Canadian Medical Association, the Canadian Medical Association confirms that for doctors, Lyme disease presents a real challenge. I'm going to quote from the letter from Dr. Francescuti, who's the president of the Canadian Medical Association. And in his letter of support for C-442, he wrote, quote, "Diagnosis of Lyme disease can be difficult because signs and symptoms can be nonspecific and found in other conditions. If Lyme disease is not recognized during the early stages, patients may suffer seriously debilitating disease that may be more difficult to treat. Given the increasing incidence of Lyme disease in Canada, continuing education for healthcare and public health professionals and a national standard of care can improve identification, treatment, and management of this disease." Now, he goes on to recommend specific aspects of C-442. So I'd like to turn to C-442 itself and describe what it attempts to do and what I hope it will do very, very soon. We have, as I've said, a significant public health challenge in Lyme disease. There's recognition of that, and I have to say I'm indebted to the Minister of Health, both current and past minister. Under Minister of Health Leona Aglukkaq, Lyme disease was made a reportable disease in Canada as of 2009. And thanks to current Minister of Health, Rona Ambrose, there was support for this bill as it made its way through the House of Commons. The fact that the bill received unanimous consent in the House in June and now has made its way here before the honorable senators is something, I think, of a tribute to nonpartisanship and to the recognition among parliamentarians that a lot of their constituents are dealing with the disease and having difficulties in finding accurate, prompt diagnosis as well as treatment. The bill calling for a federal framework on Lyme disease, there were a few changes between first reading back in June of 2012 and when the bill passed unanimously in 2014. I was amenable to any changes to speed this along, as you can imagine, and Minister Ambrose suggested a few. So the title of the bill changed. It's a federal framework on Lyme disease, and a number of other items changed within the way the bill would work. But the primary notion here is that the minister will convene a national discussion, a conference that will include provincial, territorial ministers, medical experts from across the spectrum, as well as people within the community who are suffering from Lyme disease. Public health experts from all disciplines, will play a role in coming together to do a couple of things. The minister, and I think all public health professionals will agree that it would be very useful to have a comprehensive federal framework to include the establishment of a national medical surveillance program to use data collected by the agency to properly track incidence rates and associated economic costs of Lyme disease. The second point would be l'établissement des lignes.
It would be the establishment of guidelines for the prevention, identification, treatment, and management of Lyme disease, and the implementation of best practices on a national stage.
And distribution of standardized educational materials related to Lyme disease for use by any public health care provider within Canada, designed to increase national awareness about the disease, enhance its prevention, identification, treatment, and management. The minister will, following this conference, prepare a report to set out the federal framework and publish that report on the agency's website, and continue to review this process at an interval of 5 years after the federal framework has been established. I know there has been some recent media reports of some very respected experts who have concerns. I don't have anything but respect for anyone who has concerns about Lyme disease. The point of this bill is not to take sides on medical issues. My intent here, and the bill itself, is all about getting everyone to the table. We were very fortunate, and I want to thank you, Mr. Chair, for also the work of the Health Research Caucus, which coincidentally was today. And I think it was so well put by both experts who met with us today over lunch, just pure coincidence that we were all together. And I know I may be running over time, but Dr. Moriarty and Dr. Ogden were very clear that we need to bring everybody to the same table, share information. There's a scarcity of research dollars on this topic. This bill cannot include dollars because it's a private member's bill, but I think it will mobilize resources, raise awareness, and contribute to getting help to people who need it. Merci beaucoup.